Okay, so we're going to start with the case study. Here are the acronyms. These are a little bit different than our other acronyms because some of them have diagnoses and things in them, but I'm sure you're familiar with them. So the objective today is really to take the information that we've learned over the last couple of days and apply it. So this is, kind of like your capstone project or something like that if you're working on your master's. We're not going to call it a final exam because that makes people nervous. But this is an opportunity to really pull together all the information that we've learned over the last couple of days and apply it. So we're going to meet Mr. K, and I know Bridget had asked that we read the case study overnight. I certainly understand if people didn't get to that. The barbecue was pretty enticing. So we have time today. So we're going to meet Mr. K, and he is a 76-year-old male. He was admitted to the acute care hospital on March 10th, and he has congested heart failure and right hip pain because he had a fall. The admitting diagnosis at the acute care hospital was that he has a right proximal femoral fracture, an exacerbation of his heart failure, and he has a deep tissue injury on the right lateral malleolus. His past medical history does include hypertension. We know about the heart failure, and he also has a history of some depression. Mr. K did undergo a total hip arthroplasty the day after admission on March 10th to repair that femoral fracture. He did require some post-operative diuresis and some supplemental oxygen due to his heart failure. His post-operative status was stabilized, but progress with inpatient therapy was a little slower than they had wanted, and so your pre-admission nurses evaluated him and deemed him appropriate for an IRF, and he was transferred to the Inpatient Rehab Facility on March 20th for ongoing respiratory and physical rehabilitation. So we're going to ask that you work in groups at your table. Use the documents in your folder. You're going to need the handouts of handout number 10. I think that has the case study, the full case study in it for you, and the items we're going to code. We're only going to code a subset of the IRF-PAI. We're not going to do the whole thing. And the items that we're going to code for admission are the GG 0100, 110, 130, and 170, and subsets of the 130 and 170. We're going to do M0210. We're going to do M0300. We're going to go over the drug regimen review, the N2001 and the N2003 for admission. And then for discharge, we're going to have you do GG0130, just the subset, and GG0170, again a small subset. We're going to do M0210 again, M0300, and then we're going to finish with N2005, which is the final drug regimen, section N. So we're going to come back in about 20 to 5 minutes. Anila, what time would that be? 2:25? So how about we shoot for 2:25, and then we'll go over all the responses and the answers. And again, this is a great tool to bring back to your facilities. You can print off new copies and bring them back and do some training back at your facilities as well. Okay? So we'll see you in a few minutes. Okay, do you guys want to get started? So we'll start with the admission assessment of GG0100, and this is the prior functioning of the everyday activities. So in order to code these items, we're going to indicate the patient's usual ability with everyday activities prior to the current illness, exacerbation, or the injury. So we're going to start with A, self-care, and here we want to code Mr. King's need for assistance with bathing, dressing, using the toilet, eating prior to his current illness, exacerbation, or injury. And so the correct code for this would be 3. And the rationale is that Mr. K was independent with these activities, such as bathing and dressing. He used the toilet by himself. He fed himself prior to his hip fracture. Okay, for item number B, indoor mobility. And here we want to code his ability for need for assistance when walking from room to room with or without a device, such as a cane, crutch, or walker, prior to the current illness, exacerbation, or injury. And the correct code is also 3. And remember, prior to his hip fracture, he was able to walk by himself inside surfaces using his rollator walker. For item number C, which is stairs, here we're asking that you code Mr. King's need for assistance, or Mr. K, I gave him a whole last name. Mr. K's need for assistance with internal and external stairs, with or without a device, such as a cane, crutch, or walker, and again, prior to his current illness or injury. And the correct code here would be 2. And the rationale is because he did require standby assistance from his daughter to climb the stairs to the 2nd level of his home, and that was prior to his injury. For D, functional cognition, here we're going to code the patient's need for assistance with planning regular tasks, such as shopping or remembering to take his medication prior to the current illness, exacerbation, or injury. And the correct answer for that was 3, because if you remember right, he was able to take his own medications, he was paying his bills, and he even did some of the grocery shopping, if I recall. How's everybody feeling about that? Pretty good? Okay, I'm getting nods here. Hopefully out in live streaming, they're nodding too. Okay, admission assessment for prior functioning, prior device use. And here we're going to indicate the devices that were used prior to the current illness. And remember, we can check as many as we want, or as many as are appropriate. And the correct answer for that would be A, the manual wheelchair. I think he wheeled out to his mailbox, if I remember. And the walker. And he used both the rollator walker and a manual wheelchair prior to his hip fracture. Okay, we're going to go over a subset of the GG130 self-care. And here we're going to do both the admission assessment, and we're going to also do the goals at the same time. So for eating, the ability to use suitable utensils to bring food and or liquid to the mouth and swallow food and or liquid once the meal is placed before the patient. So the proper admission performance and discharge goals should be as follows. 05 for his admission performance, and we're hoping for independent at discharge. And if you remember right, he was set up or cleanup assistance. He feeds himself, but that was only after the CNA was there to set up and open his containers and things. But the occupational therapist is feeling pretty confident she's going to be able to get him back to his independent level at discharge. For self-care oral hygiene, and again, this is the ability to use suitable items to clean his teeth if he has dentures, if applicable. The ability to insert and remove those dentures into and out of the mouth, and manage denture soaking and rinsing and the use of equipment. So for Mr. K, the proper codes are 04 for his admission performance. And again, we're hoping that he'll be independent at discharge from our IRF. If you have any question about the coding, the rationale is here. The CNA did provide supervision as he brushed his teeth while standing for safety. He also required the CNA to provide setup and cleanup assistance, but we do not consider the assistance provided to get to or from the bathroom when coding oral hygiene. And I think that's a similar example to what we saw in that video too. Weren't the videos good? Yeah, they are good. Okay, so for C, toileting hygiene. Here we want to assess the ability to maintain perineal hygiene, adjust clothes before and after voiding or having a bowel movement, and if managing an ostomy, include wiping the opening, but not necessarily managing the equipment. So the proper codes here would be 04 for his admission performance and 06 again for discharge goals. And here's the rationale. Steadying assistance from one helper while standing and adjusting his underwear and slacks was required. And again, the OT is confident she's going to get him independent. So the subset of GG0170 mobility. And here we're going to do the same thing. We're going to do both the admission performance and the goals at the same time. So for toilet transfer, the ability to get on and off a toilet or commode, the admission performance was 03, and the goal is 06. I'm looking around, people seem like that seems right to them. I'm getting nods, good. Mr. K required the assistance of one helper, providing less than half of the effort to transfer on and off the toilet. And again, we're hoping that he'll be able to return to his independent level. And as a case manager, I do a lot of case management at our place. You always love it when they can go to the bathroom on their own, because more likely to go home if people can go to the bathroom on their own. Okay, walk 10 feet. So here we're going to assess the ability, once standing, to walk at least 10 feet in a room, corridor, or similar space. And the admission performance was 03, and our discharge goal is 04. And the rationale for that is Mr. K walked 10 feet with the rollator and the assistance of one helper. That helper provided less than half the effort. He did require steadying as he began to walk, and then progressively required some of his weight to be supported for at least 3 feet of the 10-foot walk. The use of those assistive devices to complete the activity is not affected in the coding. And we do anticipate, the PT is hoping that at discharge he'll be supervision or touching assistance. Walk 50 feet with 2 turns, and that is one standing, the ability to walk at least 50 feet and make 2 turns. The admission performance is 88. And the goal for discharge is 4. Is that so? As people are nodding, that's good. Okay, and the rationale for that is the activity was not attempted due to medical condition or safety concerns, and he was just unable to because of the fatigue and his decreased endurance at that point in the admission. But we are hoping again that he'll be supervision or touching assistance by the time he's ready for discharge. Walk 150 feet. So once standing, the ability to walk at least 150 feet in a corridor or similar space. The correct codes here are 09 and 09. And the rationale for that is we have to remember that this activity was not attempted during the 3-day assessment period, and Mr. K was not walking 150 feet prior to his hip fracture. So it's not something we expect him to do now if he wasn't able to do that before. Okay, so for GG0170, does the patient use a wheelchair and/or scooter? The correct answer to that is yes. And does the patient wheel 50 feet with 2 turns, once seated in a wheelchair, scooter, the ability to wheel at least 50 feet and make 2 turns? His admission performance and discharge goals are, his admission performance is 02. But we are anticipating that at discharge, he'll be independent with that. For RR1, indicate the type of wheelchair or scooter used. Oops, sorry, didn't do the rationale, I apologize. So once seated in his manual wheelchair, Mr. K could only propel himself 20 feet and required some assistance from helper to straighten himself after a turn. He then required the helper to propel his wheelchair the remaining 30 feet. And now indicate the type of wheelchair or scooter used, and the correct answer for that is 1. using a manual wheelchair, and wheel 150 feet. Once seated, the ability to wheel at least 150 feet. And the correct responses here are O2 and O2. And that's because after propelling himself 20 feet, Mr. K was really fatigued. The helper must propel him the remaining 130 feet to complete this activity. The discharge goal is based on Mr. K's level of function. The PT anticipated that beyond approximately 170 feet, a helper will propel Mr. K for the remaining distance to complete the activity. And then the type of wheelchair or scooter used is again 1. And then we're going to do a quick Slido just to make sure that the people live streaming are participating and they can get their certificates. So this is a question we already answered, so you know the answer. It's GG17, question 1, does the patient use a wheelchair or scooter? So I ask if you could just answer that. Let us know you're still out there. We know the answer is yes. Okay, and the correct answer is, as I said, is yes, right. Very good, and it's glad to know they're still out there. Okay, admission assessment skin. Does this patient have 1 or more unhealed pressure ulcers? This is admission assessment. Is it A, no, B, 1, yes, or C, enter a dash? I'll give it another couple of minutes. Okay, it looks like it's starting to slow down, and the correct answer is yes, patient does have 1 or more unhealed pressure ulcers. And the rationale is, remember that upon admission to the IRF, Mr. K had a pressure ulcer on his coccyx and a deep tissue injury as well on his right lateral malleolus. Okay, for M0300, the current number of unhealed pressure ulcers and injuries at each stage. So what I'm going to do is I'm going to reveal the answers for each item, and then we'll do the rationale when we're done with all of them, okay? It's just a little easier. So for M0300A1, the number of stage 1 pressure ulcers, the correct response is 0. For the number of stage 2 pressure ulcers, the correct response is 0. For the number of stage 3 pressure ulcers, the correct response is 0. For the number of stage 4 pressure ulcers, the correct response, oh, look at them holding up their finger, is 1, that's right. The number of unstageable pressure ulcers or injuries due to non-removable dressing or device is 0. The number of unstageable pressure ulcers due to coverage of a wound bed by slough or eschar is 0. The number of unstageable pressure injuries presenting as deep tissue injuries is 1. Right, good. I always feel like the section M1s are kind of tough. And so the rationale is that upon admission to the IRF setting, Mr. K had that pressure ulcer on his coccyx and a DTI in his right lateral malleolus. And to accurately stage these wounds, the nurse reviewed the history of the pressure ulcers and the patient's medical record. And remember, Anne specifically kind of gave this example yesterday of a patient coming to us very similarly. So you did remember, so that's great. And although the pressure ulcer, like I said, had evidence of improvement, we have to code the stage 4 because that's what the medical records show. We don't reverse stage. Very good. And the pressure ulcer on the right ankle is the DTI. Admission assessment, so section N, medications. We're going to do this one on Slido. So this is for N 2001. Did a complete drug regimen review identify potentially clinically significant medication issues? A, no issues were found during the review. B, yes, issues were found during the review. NA, the patient is not taking any medications, or you're going to want to enter a dash for this item. Responses are coming in, that's good. Okay, pretty overwhelming with B. Let's see if you're correct. And the correct answer is yes, issues were found during that drug regimen review. And the pharmacist did identify 2 different doses of the same medication. I think one was for just mild pain, right? And then one was mild and moderate. And the combined dosage would exceed the daily dosage for ibuprofen. And the pharmacist considered this duplicative therapy and a clinically significant medication issue. N 2003, did the facility contact a physician or the physician designee by midnight of the next calendar day and complete the prescribed recommended actions in response to the identified potentially clinically significant medication issue that our pharmacist discovered? A is no, B is 1 yes, or C, enter a dash. Okay, let's see what the correct answer is. I think you all know. The correct answer is yes, they did. And on the day of admission, remember that pharmacist identified a significant medication issue. He contacted the attending admitting physician. He left a message to discuss the medication orders. An hour later, the admitting doctor returned the pharmacist's call to clarify and change the order. And that evening, the charge nurse noted and implemented the order. Okay, so now we're going to move on to discharge assessment. And we're going to do the subset of GG130. And we're going to start with self-care. We're going to do eating. Again, the ability to use utensils. Bring food to the mouth, swallow. When the meal is placed before the patient, the correct discharge code is 06. And the rationale is that Mr. K at that point was able to open those containers. I think that was what was holding him back on admission. He couldn't do that, but now he's able to do that. So that's great. And we met our goal too, so that's good. For oral hygiene, our discharge performance code score should be 06. Again, he was able to brush his teeth and completed all oral hygienes without any type of assistance by the time he left. For toileting hygiene, the discharge performance should be coded correctly at 6. And he was able to manage his perineal hygiene and clothing without any assistance. So very good. A subset of the GG0170 mobility scores. So for toilet transfer, the ability to get on and off toilet or commode, the correct discharge performance code should be 06. See a lot of heads nodding, that's great. And he was able to complete this activity without any type of assistance. Walk 10 feet, the ability to walk 10 feet in a room. Discharge performance code should be 04. And he walked 10 feet using the rollator walker with supervision from one helper. The use of the assistive device to complete the activity, as we now know, should not affect any of the coding. 50 feet with 2 turns, 1 standing, the ability to walk 50 feet and make those 2 turns. His discharge performance code should be 04. See, head's nodding, that's good. He walked 50 feet with 2 turns. He used that rollator walker and contact guard assistance. The use of the assistive device, again, should not affect the coding of the activity. And finally, walk 150 feet, 1 standing, the ability to walk at least 150 feet. The correct discharge code should be 09. And that is because the activity was not attempted. We talked about this already. You know, he was not walking 150 feet even before the hip fracture and the admission, so it's not applicable for him. Does the patient use a wheelchair and/or scooter? It's another Slido question. A is no, and B is yes. These are simple Slido questions. It's late in the day, can't make it too hard. Late in the day, Friday afternoon, you're away from home, and you're still getting them all right. Okay, so the correct answer is B, 1, and yes, and he used a manual wheelchair. There we go. Wheel 50 feet with 2 turns. What is the discharge performance code for that? The correct code should be 06. And Mr. K wheeled himself approximately 60 feet and completed 2 turns without any type of assistance. So he did really well. I think 70 feet was his baseline. Wasn't that what it took for him to get to the mailbox, if I remember the case study? Good. Indicate the type of wheelchair or scooter used. 1, the manual. And wheel 150 feet. Once seated in a wheelchair, the ability to wheel at least 150 feet. The correct discharge code for that should be 02. Mr. K wheeled himself 60 feet, which is close to his prior level of function. The helper was needed to propel his wheelchair the 90 remaining feet for the distance of 150. The helper does more than half of the activity to complete this. And indicate the type of wheelchair or scooter used, and it's a 1, manual. Okay, discharge assessment skin. This is where we really see how we do. Does this patient have 1 or more unhealed pressure ulcers or injuries? A, the answer is no. B, 1, yes, or enter a dash. Okay, looks like everybody's about in. And the correct response is yes. At discharge, Mr. K had 1 unstageable pressure ulcer on his right lateral malleolus. So I'll remind you of the answers we had before, and then we'll go through the discharge assessment. And remember what Ann taught us yesterday. We look at what is 2 moments in time, admission and discharge. I thought that was a nice, clear way to look at it, actually. Okay, so for A1, M0300A1, the number of stage 1 pressure ulcers, discharge assessment should be coded as 0. For the number of stage 2 pressure ulcers, the discharge code should be coded as 0. Very good. Number of these stage 2 pressure ulcers that were present upon admission, that's a skip, right? Because if we have none, then we can't have any of those that were present on admission. The number of stage 3 pressure ulcers should be coded as 0. The number of these stage 3 pressure ulcers that were present on admission would be a skip. The number of stage 4 pressure ulcers, discharge assessment, the correct code is 0. The number of these stage pressure ulcers that were present on admission is properly coded as skip. For the number of unstageable pressure ulcers or injuries due to non-removable dressing or device, the discharge assessment code should be 0. The number of these unstageables that were due to non-removable dressing and device that were present on admission is a skip. The number of unstageable pressure ulcers due to slough or eschar. Ooh, I heard people say it before I even clicked. Yes, 1. Very good. The number of these unstageable pressure ulcers due to slough or eschar that were present upon admission. It's a 0. The number of unstageable pressure ulcers with deep tissue injury, discharge assessment is 0. Great. And the number of these unstageable pressure ulcers, or pressure injuries, with deep tissue injury that were present upon admission, the proper code is skip. So the rationale for all those, let's just go over it. So remember, Mr. K had an unstageable pressure ulcer due to slough and or eschar on his right lateral malleolus at discharge. This pressure ulcer was identified as a deep tissue injury on admission. During the patient's stay at the IRF, it was reclassified as a stage 4. However, at discharge, slough completely covered this pressure ulcer, preventing visualization of the wound bed. Therefore, it is considered not present on admission. A numerically staged pressure ulcer that becomes unstageable due to slough or eschar at discharge would not be coded as present on admission in M0300F2. The healing stage 4 pressure ulcer that was observed on admission on his coccyx, you guys did a great job, you healed that up, so that's closed. It is now considered to be a healed stage 4 and would not be coded on M0300 in the discharge assessment. Everybody good with that? Okay, good. Very good. I thought that was kind of complicated, so that was good. So for section M, medications, did the facility contact and complete a physician or physician designee prescribed recommended actions by midnight of the next calendar day each time a potentially clinically significant medication issue was identified since the admission? So we're going to ask you, is the answer no? Is the A? B is yes. They did every single time they called, and then they changed the order in time before midnight. Or N, NA, or D, enter a dash. Okay. So the proper answer is B, yes, they did. So the rationale is the clinically significant medication issue identified by the pharmacist on the day of admission was communicated to the physician, and the physician's recommended actions were completed by midnight of the next calendar day. Because remember, the discharge one also includes if there was an issue on admission. It's throughout the whole stay. And then we also know that on day 5, Mr. K had a clinically significant medication issue related to his hydrocodone. A physician was immediately contacted, and the physician's recommendations of administering diphenhydramine providing nasal oxygen and discontinuing the hydrocodone and monitoring for bleeding were addressed by midnight of the next calendar day. And then after that day 5, up until his discharge, there were no other clinically significant medication issues that were identified. Okay, so you have a few minutes if you want to record anything in your action plans related to the case study. Anything you want to bring back? Any ideas you have for implementing, maybe using this particular case study for some of your clinicians back at the office? And then if you have any questions related to the case study, you can enter them into Slido so that we have them and can answer them for you. I just want to thank everybody very much for your attention. I know it's late in the afternoon, and I really appreciate your attention. And it was really nice to look out and see some friendly faces and nod yeses and answering me. So thank you so very much. Okay, have a great trip home. Thank you.